The pain was really bad when it first happened. Like, I was crying. Yeah, it was really bad. I was at my cousin's house helping her carry platters. My hand started hurting really bad, and she took me to the hospital.
When she first came to see me, she had really bad tendonitis and was in severe pain and couldn't move her fingers or wrists at all without screaming in pain. Tendonitis in her case was caused from overuse and from doing too much heavy activity. She was hesitant to get a steroid shot, which is understandable, so we first tried to treat her pain with medication, bracing, and physical therapy, but her pain was still really bad.
She's been in a lot of pain all of her life, mostly. She had some other surgeries, some brain surgery, and then the finger and thumb basically never was right.
So I actually did, at a subsequent visit, give Jeanne a steroid injection, which calmed down her tendonitis. But after her hand and wrist were feeling better, she and her father started talking to me about thumb pain that she had been having. Jeanne had had thumb pain in her left hand for her entire life, which was 21 years at that point. She was born with her thumb being a little bit underdeveloped, which made it hard for her to hold things.
I was having trouble moving it like how this thumb moves. I wasn't able to move it.
We kind of like gave up on it because the doctor was saying ain't nothing they can do until Dr. Bauknight basically looked into it a little further, and that's why we chose her for the operation.
After consulting with multiple other experts in the field, Jeanne came back to me and she said, I want you to do the surgery. I want you to fix my thumb. And that was a huge honor, but also a huge task. So what we did was I fused one of her thumb knuckles. It was unstable from birth, so I fused it so it became one strong bone that now she was able to use to pick up things and hold things, whereas before it was floppy and unstable.
On the way of recovery has been enormous. It's been a miracle, basically, because it's something that she never used, and her thumb, and she's able to do certain things with it. And just to see her not in that type of pain anymore.
So now she had to learn how to use her thumb for the first time in 23 years. So she's been doing occupational therapy and gradually getting to use it more and more, feeling like it's a functional thumb now for the first time in her life.
My thumb is doing better than what it was. It's actually doing amazing. One of the things I'm able to do now is basically trying to hold things with it, and I've been trying to do majority everything that a normal person would be trying to do.
This is exactly why I became a surgeon, to help people get back to what's important in life, to be able to give Jeanne the ability to do things she hasn't done for her entire life is beyond rewarding. And I've loved being able to get to know her and her family and watch her do new things and have new abilities every time she comes back to see me for a follow-up.
Jasmine Bauknight, she helps me through everything that I was going through with my hand, and I'm forever grateful for that. She really helped me get to where I want to be.